This is VOA Africa.
Hello, I'm Esther Githui-Ewart. It's Tuesday, April 28th. This is Africa 54. Due to the global outbreak of COVID-19, Voice of America is taking every necessary precaution to safeguard its employees. So our broadcast will look a little different today and in the near future as we, out of an abundance of caution, reduce our staffing at our VOA headquarters here in Washington. We're working to help keep you informed about what's going on, and we appreciate you staying with us on Africa 54. World Health Organization Director General Tedros Adhanom Ghebreyesus is urging European countries that are easing their lockdowns because of declining numbers of new cases to, quote, find, isolate, test, and treat all cases of COVID-19 and trace every contact to ensure these declining trends continue. His comments followed an easing of restrictions in Italy, Spain, and Germany. France, one of the hardest hit nations with more than 23,000 coronavirus deaths, is announcing its plans to begin easing restrictions on Tuesday. Confirmed global cases of COVID-19 have surpassed 3 million and deaths have exceeded 210,000, according to Johns Hopkins University. Worldwide, an average of 82,000 coronavirus cases have been reported per day in the past week. Over 25% of all cases are in the United States. The U.S. is reporting an average of more than 30,000 new cases a day in the past week, and now represents around 1/3 of all new cases. Now to Africa, where over 40% of the continent's nearly 33,000 cases are in the north, according to Reuters. Morocco, Egypt, and Algeria are reporting heavy outbreaks of the disease. In West Africa, Nigerian President Muhammadu Buhari says his country will begin a gradual easing of COVID-19 lockdown restrictions in Lagos, Abuja, and Ogun states on May 4th. The new measures also include the mandatory use of face masks and a curfew from 8 p.m. to 6 a.m. with only essential travel allowed during the 10-hour period. Nigeria is reporting nearly 1,300 cases of the coronavirus and at least 40 deaths. In Algeria, the Prime Minister's office says it is extending its lockdown restrictions a second time by 15 days until May 14th. And in Burundi, the race to become next president is officially underway as authorities proclaim God will protect citizens from the coronavirus, which has infected 15 people in the Central African nation and caused 1 death. The May 20th vote is for a successor to Pierre Nkurunziza. Communities in the United States and around the world are talking about when and how to ease lockdown measures as they grapple with the COVID-19 pandemic. The disease and how it spreads presents unique challenges. People without symptoms can infect others, and for some, it can be deadly. What if a smartphone app could let you know if you have been exposed? VOA's Michelle Quinn reports.
Communities around the world have slowed the spread of the coronavirus by locking down society. But there is fear the virus will begin to spread again once those restrictions are lifted. Renu Dillon, a doctor, worked in Guinea in West Africa during the Ebola crisis. He helped find people who had encountered a sick person, a practice known as contact tracing.
But certainly with Ebola, as soon as somebody had symptoms, we would try to recreate where they've been, who they've been around. Based upon that, we would then be able to make a list of people who were contacts. And we would follow those contacts for Ebola for 21 days.
COVID-19 presents challenges to tracing contacts. Some never have symptoms. Others can spread the disease for a day or two before showing symptoms. But what if you could digitally trace people who have been exposed? Apple, Google, and others are looking into using smartphones to inform those who have crossed paths with an infected person.
Something like digital contact tracing, I think, could make a huge impact in terms of automating the process of identifying who's around somebody for those periods of time.
Some countries have been using cell phone apps to trace people who might be sick. This proposal relies on Bluetooth, a radio signal built into phones to connect to other devices, like headphones. It is constantly emitting and listening to signals, a long string of numbers. Maybe once a day, the phone will do an exposure check. Contact a server to see if one of the beacons you've received came from someone who tested positive for the coronavirus. But will it work and be accurate? Mark Zisman is with the Massachusetts Institute of Technology's Lincoln Laboratory, which has worked on missile defense and laser communication to the moon. He and his colleagues are testing how to measure the energy emitted from these Bluetooth beacons so that digital contact tracing works.
When these chirps, when these Bluetooth signals go between the phones, you measure how much energy is received. And you use that in part. It's not the only thing you use, but you use that in part to try to estimate how far apart you are.
MIT is working to test how best to measure signals in a variety of situations. Bluetooth signals pass through walls, for example.
Was it free space between us, or were there things, whatever? Was there a mask? Was there a wall? Was there a piece of glass? Were we facing different directions altogether? I mean, those things all matter. And so we got to measure that too. And that's really hard.
In the model Apple, Google, and others are proposing, no name is shared, no location is shared. The beacon data lives on the person's phone, making it less of a target to hackers than if government health authorities stored the data. Of course, the phone in your pocket isn't going to tell you whether you're carrying the virus, but digital contact tracing might play an important role as society opens. Michelle Quinn, VOA News, Oakland, California.
It's time for a health report, and joining us now is Africa 54 health correspondent Lino Mudu with a look at added symptoms for COVID-19.
The U.S. Centers for Disease Control and Prevention has added 6 new symptoms to its existing list of symptoms for COVID-19. The coronavirus is highly contagious and potentially deadly, but the vast majority of people who become infected will show either no symptoms or only mild ones. Chills, repeated shaking with chills, muscle pain, headache, sore throat, and a loss of taste or smell are the 6 new symptoms the CDC cautions that could be signs of COVID-19. The symptoms usually appear within 2 to 14 days after exposure to the virus, according to the CDC. It recommends seeking medical attention immediately for trouble breathing, persistent pain or pressure on chest, bluish lips or face, or renewed confusion or inability to arouse. Experts say the expanded CDC list is significant as most testing sites require a patient to have a COVID-19 symptom before the individual can be tested. Because a loss of smell and taste has been identified as a symptom of the coronavirus, health experts say anosmia, or the loss of smell, is a common symptom for respiratory viruses, such as the flu. In our Ask the Expert segment, Dr. Carl Philpott, professor of rhinology and olfactology at the University of East Anglia in Norwich, England, elaborates on the loss of taste and smell associated with COVID-19.
Some people are getting it at the beginning before other symptoms. Some people are getting it after other symptoms have developed. And there is a group of patients who seem to be getting that and nothing else at all. And I think that's why it's important to kind of investigate the association further, because obviously if some people are getting only that symptom, then they're wandering around there as sort of, as carriers of the infection without perhaps realizing and perhaps isolating themselves in the way they should do if they'd had the other symptoms which they're recommended to isolate for. Well, typically we see that women for post-viral loss tend to be classically more affected on a ratio of about two women to 1 male patients. Certainly, I think the notable thing about the data so far is that it seems to be the younger patients are getting the smell loss and younger than we typically see for post-viral smell loss. So it seems to be people in their sort of 30s and 40s that are getting this a lot. Typically, viruses, as I say, cause about 11 to 12% of all cases of smell loss in the community. But it may be that percentage goes up as a result of this pandemic.
Now to Niger. United Nations agencies have partnered with Niger government to build a makeshift hospital in Niamey to help fight the COVID-19 outbreak. Take a look.
In Niger's capital, Niamey,
The General Kunche Stadium has been transformed into a reception and treatment center for coronavirus patients. The country's Prime Minister, Briggy Rafini, is receiving the keys to the mobile hospital, which was built by the local representation of United Nations agencies.
I receive with great pleasure the keys to this infrastructure you have successfully set up here at the General Seyni Kuche Stadium in Niamey, in which will substantially increase our capacity in welcoming and treating our patients. I would like, on behalf of the President of the Republic, on behalf of the government, on behalf of the entire people of Niger, to say thank you.
The United Nations Population Fund, UNFPA in Niger, has equipped the new health center. The UN agency is working in partnership with the government through the Ministry for the Promotion of Women and Child Protection. UNFPA's Elimine initiative, a program that provides education and literacy training to adolescent girls, is also lending a helping hand. Nearly 300 of the girls have been trained in Niamey by Nigerian stylists in the making of masks. The young women produce 10,000 masks per week, distributed by the government, including the Minister for the Promotion of Women and Child Protection, Elbak Zinabu Taribako. Ismaila Mbeng is UNFPA representative in Niger.
We have made some 150 doctors available to the government as response, and several of those doctors and midwives will be assigned here at these sites to take care of the 100 patients who will be admitted to the sorting center. On the material level, we provided everything you saw inside the tents: the chairs, the trash can, the water tank, as well as the air conditioners.
The United Nations High Commission for Refugees, UNHCR, in Niger, built the makeshift hospital, and some refugees have volunteered to join the fight.
C'est le signe de la solidarité des réfugiés.
This is a sign of solidarity from the refugees who have been welcomed here in Niger. They have asked me to tell you that they are there for Niger and that they are working in the production of soaps, gels, and bleach to distribute to everyone, and in particular to hospitals.
UNFPA and UNHCR intend to establish similar health centers in other cities in Niger, like Tawa, Agadez, and Tillaberi. According to Niger's Ministry of Public Health, there are at least 670 cases of COVID-19 in the country. Authorities have declared a state of emergency and imposed a curfew. And that's our health report for today. To stay in touch, find me on Twitter at Lenore Modou. Esther?
Thanks, Lenore. Join us again next Tuesday for another health report on Africa 54. In Spain, the city of Barcelona has been quiet for months. It's required everyone to change and adapt to a new normal. Alfonso Bido has the story.
In Spain, lockdown started 14th of March. Since then, we are not allowed to go to the street. We only can go to buy food or taking out the trash. In this building, we have a good relationship with our neighborhood, especially with those who has also kids. Victor used to go to Manuel or Greta's house, or they used to come here. They have not seen each other for a month and a half. They communicate between them by video conference. Now we are able to take them out for an hour. Maybe they could see each other, but physical contact is not allowed. They will not be able to give a hug or play together. Routine has become our most important tool. Routine gives security to children. In the morning after breakfast, you have to get dressed. After them, writing and reading classes begin. Later, drawing and playing. After eating, he can watch TV. Creativity has to be like passions, endless. You have to invent activities to combine entertainment and physical exercise. Before dinner time, we do video conference call with family, Victor's grandparents and the two older brothers who are not home. Then comes the time for shower, dinner, and watch TV, this time in English. At 8 o'clock, it's a very special time. We go out of the window to applaud with our neighborhoods to the men and women who are fighting in the front line. From now on, the kids can go for an hour to the street. The small step of the kids will guide us to a new normality.
We're excited to hear what you think about Africa 54 and the stories we cover. Join the discussion on Facebook. The address is Africa 54. We're also streaming our broadcast live on Facebook. Please watch and share our show with your friends. Also check out our headlines 24/7 on voaafrica.com. Still to come, restriction and lockdowns for humans during the COVID-19 pandemic becomes freedom for wild animals. We'll be right back after this short break.
Alongside Nigeria, we survive the future with Mr. Soprano. You know what it is, my bad records. Get it on. Too many haters thought that I ain't gonna be here. I'm ignoring the fake track in my pen. Never fun. Never fun.
Welcome back to Africa 54. As American doctors fight one of the world's worst outbreaks of COVID-19, several are reflecting on what they wish they knew when they first began to fight the coronavirus. VOA's Mariama Diallo reports on the lessons learned as U.S. deaths from the virus exceed 54,000.
With the U.S. accounting for nearly 1/3 of global coronavirus cases, some doctors in the United States say they've learned a lot on the front lines of the battle against the disease. That includes a better understanding of how to help patients who come in with low oxygen, for example, says the medical director of the Mount Sinai Hospital Emergency Department.
What we saw early on is that as soon as somebody started to get, to 6 liters of oxygen on this nasal cannula, they just got worse and worse, and so we jumped to intubation. Now we're realizing that probably something in between for some patients, like putting them on that high flow oxygen or putting them on that BiPAP, may actually be okay for some. The other thing that we've learned is that actually you can prone people.
Proning is a method of lying patients on their belly that has been successful, explains another internist and critical care cardiologist at Columbia University Medical Center.
The theory is that the lungs are like a sponge, and if you lie on your back for a very long time, that gravity sort of pulls all the secretions and the fluid and mats down that part of the lung, and that by flipping people over, you free up that space in the front of the torso to allow the lungs to open and expand and give better oxygenation, and it works.
She also says hospitals ran short of key equipment, something hospitals in Italy, Spain, and other hotspots have also experienced.
We all wished, for the sake of people, that we had recognized that this was coming earlier, could have had things in place for hospitals to manage patients, probably could have prevented a lot of the mass amounts of people that came in all at once, had more PPE available so that people weren't without it.
Internist Dr. Anju Gawel says the most surprising has been how the virus affects the elderly.
What I did not recognize was the severity of illness that would be seen in patients who are older. Had we known that, we could have instituted more restrictive control measures to prevent exposure to that group, and also to get very early treatment for that group to try to prevent the complications.
For most people, the disease causes mild symptoms such as fever and cough. For some, especially older adults and people with existing health problems, it can cause more severe illness, including pneumonia, and can lead to death. Mariama Diallo, VOA News.
The production of a ventilator normally takes 1 year or longer, but a group of researchers and engineers worked to make it happen in 1 month at a fraction of the normal cost. Mass production of the spiral wave bridge ventilator is underway as low-cost ventilators could prove especially helpful in developing countries where supplies are lacking. VOA's Tina Trin has the story.
At Boyce Technologies in Long Island City in the state of New York, new ventilators are coming off the production lines, ready for a city that's become the epicenter of the coronavirus pandemic.
We placed an order for 3,000 of these ventilators, a $10 million order.
These spiral wave bridge ventilators are not just a feat of engineering, but one of sheer determination. They were conceived and produced in a month's time. The cost? Less than $5,000 instead of the typical $30,000. And it's done by a group that until recently didn't make ventilators. Scott Cohen is the co-founder of New Lab, a technology hub in Brooklyn. A New Lab member living abroad saw the mounting death toll in Italy and asked Cohen and another member in New York about the possibility of New Lab building ventilators.
Both of us had the same reaction, like this looks complex.
But Cohen discovered a 10-year-old design for a basic ventilator from the Massachusetts Institute of Technology, or MIT, and reached out to the researchers.
We sent a team up there to meet with the team that had formed maybe 4 days before up at MIT to kind of revive this old design.
MIT engineers Shakti Shaligram and Kimberly Jung tested an early prototype on lab pigs.
We put our device into a 80-kilogram pig, so a pretty big pig, and the device broke.
This is part of every design process for everything, like things always fail.
But through continual refinement, a year's worth of engineering was done in a month.
We tried to come up with a design that could be made many different ways. We're a research institution. We're not a production house.
That part was up to the New York team.
We were doing a prototype every 24 to 48 hours.
Marcel Bota heads up product development firm 10X Beta.
Whenever we left the building, we went home to sleep for 4 hours, or we went to Boston to test the device there. There was nothing else but that.
The result is SpiroWave, a bridge ventilator that automates airflow to patients, helping them breathe when they can't on their own.
We have a real-time pressure feedback and safety systems and alarms that help to upgrade what a normal bag would be able to do by itself.
While it's not meant to replace a traditional ventilator, it can act as a temporary stand-in.
If they have a limited number of ventilators and they've gotten the patient through a really critical stage, they can move them onto this ventilator as a bridge.
The device has received authorization from the U.S. Food and Drug Administration for emergency use.
I think we all should be thinking about what can we build and what can we fix and who can we do it with.
Tina Trin, VOA News, New York.
As humans shelter in place to help contain the spread of the COVID-19, it's making the outside world a quieter, less crowded place. That's good news for wild animals, many of which are feeling emboldened to venture out beyond their normal territories. VOA's Julie Tabo has the details.
At Yosemite National Park in the northern part of the state of California, a bear ambles fearlessly across a forest glade, and a herd of deer stroll down an empty road. The park, famed for its waterfalls and giant sequoia trees, normally attracts more than 3 million visitors a year. But since it closed to tourists under coronavirus guidelines, normally shy animals are venturing out.
If you were to be there in person, it is quite a sight because it's very quiet right now in the park. You hear the natural sounds of the river and the wildlife and the birds.
From elephants taking a stroll in a suburb in India to a young puma on the streets of Santiago, Chile, wild animals are being spotted in the unlikeliest places. Professor Sarah Bekasi explains.
A lot of these species have been existing on the periphery of cities, but because the threats that they typically experience, the traffic, the noise, the the air pollution and the conflict with people have been dramatically reduced from the self-isolation that we're all having to experience. These animals have been emboldened to actually re-enter these places.
That's certainly the case in Great Britain, where residents in lockdown in a London suburb have been enjoying regular visits by a herd of friendly deer.
My little girl thinks that Santa sent the reindeers because we're all locked down, so he can keep an eye on everyone and make sure everyone's safe.
Would you like another one? In Italy, a Tuscan family adopted a fawn that considers itself part of the family.
He's at the front door again this morning and we went for a walk again. He spent the day with us yesterday and he just joined us pretty much in everything.
But not all wildlife encounters have been so friendly. In the Israeli city of Haifa, where the coronavirus is keeping residents indoors, wild boars have swarmed into people's gardens.
Salam!
Onto deserted streets, rooting through garbage and spooking residents.
They are all around here and we are terrifying that they will bring us corona or other disease.
The coronavirus lockdown has brought out wildlife in other parts of Israel as well. In Tel Aviv, packs of jackals have taken over a deserted park, scavenging for food in what is normally a playground. But some residents are taking it all in stride.
Usually these animals are not doing anything to people, to pets. People have to understand that they are going to stay with us. They were before, and they are going to stay after us.
I really hope that this time in self-isolation, when we're actually seeing these remarkable things happen in our cities, will awaken us to the fact that we can share our spaces with wildlife. And it's enchanting and it's beautiful and it's something that we should desire.
In these days of uncertainty, self-isolation may be an ideal time to reflect on how we share the earth with other creatures. Julie Tabo, VOA News.
And that's our show for today. Be sure to watch Africa 54 on our website at voaafrica.com. From all of us here in Washington, thanks for watching.